please click on the YouTube subscribe button to get updates as we release new videos. You may have heard a little bit about WeATrust. You remember WeATrust, originally back in January of 2011, when the governor started to go after schools. There was this whole campaign by the right wing to demonize WeATrust and to say that they were responsible for the crisis in the schools before they attacked the teachers as being responsible for the crisis in the schools. But actually, WeATrust is a not-for-profit health insurance company. And when you look at the papers, the financial matters related to health insurance, when you think about the kind of plan that I would buy as a farmer, roughly 40% of that money that goes into premiums goes into profit, advertising, and overhead. So we use in the healthcare business the word medical loss ratio, but basically it's not a loss. It's how much they're paying out of the money they take in, how much they're paying out in claims. Just to give you a feel for what it looks like. With WeATrust, it's at somewhere around 95% of the money they take in, they're paying out in claims. The reason I'm talking about this is because if we're going to solve the problem of healthcare, which is a huge and critical problem for anybody in small business, we have to figure out how to move away from for-profit health insurance companies and towards what I would call not-for-profit or cooperative health insurance companies, which one of the things that makes the American system different, and there are a lot of things that make it different. One of the things that make it different is we have so many very wealthy health insurance, for-profit health insurance companies. And so when I think about this, and I think about my background as a farmer and all the work that I've done with cooperatives, I think that herein lies the answer to many of the problems we face as a culture, as a society, as a city, as a state. If we can somehow grow the idea of cooperatives, we begin to tackle some of those very, very difficult problems.
The healthcare again, if Affordable Healthcare Act fails, are you among the people who will be fighting for single payer? And do you think that would be equally beneficial to cooperatives?
Well, single payer, I've spent a lot of time working on healthcare, and single payer can mean a lot of different things. It can mean the VA system where the government owns everything, and all the doctors and nurses work for the healthcare system. It can mean like our Medicare system where one payer pays for everything, but we have private doctors and hospitals. Or it can mean something like we have an exchange and all of the health plans run through that exchange, and then the exchange collects the payroll tax and pays out all of the bills. And that last example is what we did when we developed the idea of Healthy Wisconsin back in 2007, which was a bill that I wrote along with Senator Beck and Senator Miller. So when I think about the answer to your question, the answer depends on which part of the healthcare system that you think of. If you have a VA system, or like the British system, where the government owns everything and the government pays all the bills, then a cooperative would not have a role because there would be nobody to bring everybody together and use that role. But if you modeled it after the German system, where you have what they call sickness funds, but they're very much like group health co-op, where they have cooperatives mostly associated with different unions and different trade groups. They're all competing, they're all private, they're all non-profit, which is important. And the hospitals and the doctors are private. In that kind of situation, which is very similar to the way I'm imagining an exchange would work, in that kind of a situation, then absolutely yes, it would be vital that you would have those cooperatives compete. If you had completely single-payer system in Wisconsin, that we would save almost twice as much in terms of overhead. That the savings would be almost twice as much as moving from our current system to the model under that we developed under Healthy Wisconsin. And if you went one step further, then we would save almost twice as much. So how should I say this? The rest of the world, other industrialized nations, pay half as much and have a healthier population. Why is it that they do? One of the big reasons is because of the profit factor in the healthcare system at every level. Now, how to get there is the challenge. And it's something I've spent a lot of time thinking about. And I believe that how to get there is in stages. And we begin under the Affordable Care Act's opportunity for us to create a Wisconsin-based exchange. And we start with the most difficult part of the market, which is the small business / individual like me, the farmer, buying insurance on our own. We set up that exchange. We show, and we have a lot of data to show that this can happen, that we bring down costs. When we bring down costs, it's a no-brainer for the bigger companies to say, this is working, let me in. And under the federal government, if the Affordable Care Act stays in place, we can expand to all sizes of businesses by the year 2017. At that point, we have a real potential to develop a model in Wisconsin that could lead the rest of the country in terms of providing that value that we strive for, both high quality and low cost. Now, to do that, we have to take the first step, which is to create the Wisconsin Exchange. And of course, our governor, in his infinite wisdom, sent back the $35 million that we need to do that. And one of the first tasks I would do as governor is call up Kathleen Sebelius and get down on my knees and say, please, won't you send us back this $35 million, because we so need this money to get started. Time is wasting. We are only one of 16 states in the nation that have made little to no progress on this problem, and it affects every sector of our economy, but it especially affects the sector that's responsible for the most growth in any economy, and that is the small businesses and the entrepreneurs. So to me, it's a no-brainer that part of solving the job problem is solving the healthcare problem.
My bread and butter as a daytime cab driver is taking people to doctor's offices. Now, I've taken a lot fewer people to doctor's offices in the last several months because a national corporation has come into the state and taken away half of our business. And I think giving people very poor service as a result.
Yes, I could not agree more. And I could give you a lot of stories about what's happening out in western Wisconsin at the same time. People that are driving all the way from Polk County to pick somebody up in Buffalo County to take them to the doctor in La Crosse. People that don't even show up, that promise they're going to be there and never show. This is a very big problem. It was a political contract. It is the tip of the iceberg in terms of the problems with bad contracts in our Department of Health. And I could go on and on and on about the problems that we have in the administration of state government with very bad decisions related to contracting. And that would be on the top of my list. This is just a quick answer, but there's a whole lot more information on my website at kathleenfeinhout.org. Please share this video on Facebook, YouTube, Twitter, and email. Early voting has started. Contact your clerk. You can vote right